the room.
Hello.
Hello.
Hi, I'm Dr. Aisha. I'm one of the junior doctors here in the GP clinic. Could you just confirm your name for me, please?
Yes, I'm Mr. George Matthew.
And your age as well, please?
I'm 36 years old.
Okay, and what would you like me to call you?
George is fine.
Okay, George. So, how can we help you today here?
Uh, the doctor, I'm not getting better. I'm still depressed.
Oh, I'm sorry to hear that. So, I can see that you've been diagnosed with depression.
Yes, doctor.
How long ago was that?
It was 4 months ago.
4 months ago, okay. And you were seen by the psychiatrist, right? The specialist?
Yes, doctor.
And how did that go? Could you tell me more about the whole experience?
Well, you know, I was really depressed at that time, and they referred me for the counseling sessions. You called it like CBT. And
Mm-hmm.
to be honest, it's not giving me any help. I'm not getting better.
Oh, and I'm sorry to hear that. Um, what were you feeling when you first started and went to the psychiatrist?
Well, I was feeling very low and I was not able to concentrate on anything. I didn't feel like going out with meeting people, and I used to stay at my home all the time. And, I was very anxious, and it was going a lot during that time.
Okay, I see. And has the specialist assessed you in any way or run any tests?
Now they didn't do any investigations and any tests.
Okay, and have you been going to the CBT counseling sessions?
Yes, yes, doctor.
Have you been going regularly?
Yes.
Okay, and how did you find them?
Well, I think it's not helping me at all.
Okay, I see. And how would you describe your mood, like if it was a scale of 1 to 10, with 1 being the lowest mood and 10 being the highest and happiest mood, before you started and versus now?
Well, you can say it was 5 before and now it is 4.
Oh, and now it's 4?
Yes,
Oh, I'm sorry that that's been happening. How are you feeling now?
I'm not feeling fine, doctor. Please help me.
I'm sure I can help you. Just like to know a bit more information. Um, have you lost, are you still losing interest in things that you used to find pleasure in?
Yes, doctor.
Okay, and how's your sleep?
Well, my sleep is fine.
So you can go to sleep normally?
Well, it takes a lot of time, but yes, I can manage that. It's fine.
Okay, and how's your appetite?
I don't feel like eating these days.
Okay, I see. And has that caused you to lose any weight?
Not apparently.
Okay. And do you have any family around?
No.
Any friends?
I have many friends, but I have stopped meeting them.
Okay. And have you talked through what's going on with anyone of your friends?
No.
Okay. And do you have um, like some people, when they get depressed and they start feeling down a bit, they can sometimes get thoughts of ending their life. Has that ever happened with you?
No, no.
Okay, well, I'm glad to hear that. And do you feel like we can help you as medical professionals in any other way?
Well, doctor, I was hoping if you can give me some antidepressants.
Okay, why in particular antidepressants? What do you know about them?
Well, I know the CBT is not working for me, so I think the antidepressants are going to help me at all, in any way.
Okay, okay, yeah. Well, I'm sure we can help with that. And do you have any medical conditions
No,
other than
doctor.
depression?
Now,
Are you taking any medications, even over the counter medications?
no,
Any allergies at all?
No,
And has anyone in your family been suffering from a mental illness?
no, doctor.
Okay, and how about your lifestyle? Do you drink any alcohol?
No,
Okay, do you smoke?
no, doctor.
Okay, well, thanks for answering all my questions. I'd like now to quickly examine you. I'd like to start with your observations. That's your blood pressure, pulse, breathing rate, oxygen, and temperature. Um, and um, and that's it really for now.
Everything is fine.
Okay. Well, I think now you're still having symptoms of depression despite going to counseling sessions like CBT. So I'm afraid we have to do something more to help these symptoms. So I could offer you a different type of CBT, a more focused CBT that is more specified to you personally and your case. How do you feel about that?
But it was already specified, doctor. But as I told you, it's not working for me.
Okay, and was this CBT just one-on-one, or were you having counseling sessions as groups?
It was on one, doctor.
Okay, and how would you feel if you had counseling sessions in groups where you meet other people who've been going through a similar condition like you?
I don't want to meet any people, doctor.
Okay, well, it's up to you. So, what I suggest now is that you continue going on the using the CBT counseling, and we would add some antidepressants for you. We can start by using sertraline, but first we need to run some tests to make sure that there's no problem in giving you any medications, okay?
Okay, all right.
So we'll just run some routine tests like your blood to make sure that you're not anemic, check how your liver and kidneys are doing. And we'd also like to perform an ECG, which is a tracing of your heart.
Okay, so the doctor, are they going to affect my sexual life?
Unfortunately, they do affect, they can cause some degree.
Dr. Minahan, what do you think about Dr. Aisha's performance?
We definitely she performed really well, but let's move on to the feedback so that she'll be knowing where exactly there were few mistakes. What about that, Dr. Asha? So you
Okay,
can
okay.
continue with the feedback.
All right. Okay. So, first of all, it was a follow-up case. So we have the structure for the follow-up case. You can't start the follow-up with the how may I help you?
Okay.
So it's look a kind of bit awkward at the same time because you have seen the patient previously or the patient has been here previously. But it's always better to paraphrase for the follow-up scenarios that I understand that you had been here or you were you are here for your follow-up. So how may I help you? That's how you can say how may I help you. And do you have any concerns? I can see that you have some concerns. So how can I help you? So that is how. In the follow-up scenarios, you always have to paraphrase from the stem. I understand that you are here with this. Okay. So it was the first thing, and then about asking about. I told you that I am depressed. So you should have explored a bit more about the previous depression. Okay. So you asked me when it was diagnosed, and were you given any treatment at that time, and how have you been feeling since your last visit? And then what sort of treatment was given to you? Okay, so was there any particular reason that you were diagnosed? You should, you must have asked about the reason of depression as well. So why
Okay.
he's still, feeling low and he still cannot overcome his depression. And then after that, about the CBD sessions. For how long have you been going there? Are you regular with them? And how many sessions have you taken? And what sort of CBD sessions they were? Like, was it group therapy or was it individual therapy? As you mentioned in the management, that we are going to give you more focused CBD, and I told you that I already having a one-to-one session. Okay, so it's always better to ask in the history in the data gathering part that what sort of therapy was it? Okay, and then you are going to ask about the mood, and then you ask me about, have you lost active interest in the activities? And then the minor symptoms of the depression, like the mood, appetite, and sleep. You asked me about the sleep. And then the family and friends suicidal question. It was a good thing that you asked me. And then the psychosocial. You asked this in a very well way. But you didn't ask me about my job, about my work life. Okay, so in here the job is also important because the patient may in the STEM actually the scenario the patient must be having a lot of difficulties and lack of concentration at work, and that's why he's going to lose his job. So that's why he's really worried about that. And after after the job, you can ask about the past medical history. Then you ask me about any uh, depression, any medical condition. So you should have asked is the first time that you have been diagnosed with the depression. And then after that, about the DSA about the smoking and alcohol and appetite and all these things. And then the sexual history. Sexual history is also important because the patient is going to have concern about the antidepressants. That is it going to affect his sexual life or not? So sexual activity and the sexual history is also important here. And then after that, you are going to tell the management again. The patient know that he was diagnosed with the depression. So you can ask that what you were told about the depression. Do you know what depression is actually? So you can again explain that the feeling constantly low and losing interest in things you used to like, and it can in medical term we prescribe or describe it as a clinical depression. So as you will start as you have been going through to the CBD sessions and it is not helping at all. So what we can do is that we can start you on the antidepressants, and then you will explain about this antidepressant we are going to prescribe you. And again, it is really important to tell about the time period or the time frame for the antidepressants to work, because usually they will start working, they will take 2 weeks to work, and they can take up to 6 weeks as well to for the peak point to start working. So it is really important because in that period of time the patient will be thinking that even the antidepressants are not helping me at all, and he may be feeling low at that time during that time as well. So it is really important to discuss this time frame with the patient as well about the antidepressants. All right, and then you are going to tell you have to take this medicine for at least 6 months, and then there are some side effects that doesn't happen to everybody, but if you have any kind of dry mouth, dizziness, and feeling low and these kind of things, where you can come back to us and we can cater these side effects as well. Then patient will be having a concern that is it going to affect my sexual life? So well, you will say that yes, it can affect your sexual life, but what we can do is that we can offer you another medication that doesn't have this side effect. So in the antidepressant, you're going to start with the sertraline, and the reboxetine. It doesn't cause any sexual, side effects. So you can offer then reboxetine as well. And after, in addition to the antidepressants, what you are going to say, because the CBD and the lifestyle changes and all these things are important at the same time, because eventually he's going to he's taking antidepressants all the time, he's not going to do work on other things and the lifestyle changes. So it's not going to affect him in a better way. So what you can say is, in addition to the medication, we also advise you to continue with the talking therapy as well as because it works differently, and it can process your thoughts to make you understand what actually you're going with, and you can talk with other people of the similar condition, and they can motivate you and they can have a lot of help available for you. And at the same time, we have seen many people benefit from talking with their family, with their friends, and also there are a lot of online sport groups available for you. You can join them as well. How do you feel about that? What do you think about that? Am I making sense? Am I clear so far? And is there something you can do? How do you feel about this plan? And that's how you will involve them during the management. And then after that, we will have a follow up with you within 2 weeks. As the patient is 30 years above, so we'll have a follow up after 2 weeks. If the patient is less than 30 years, then we will going to have a follow up after 1 week. And then at the safety net, you will safety net about the suicide, and then you will tell about the crisis team number, and you will tell them that there is a crisis team is an acute mental health service that is available 24 by 7. And if you feel like you feel unsafe and you feel like that you're going to harm yourself, please ring them, and definitely they are going to help you with that. So this is how the station will go. And okay, so Dr. Minahil.
Yes, Dr. Aisha.
Okay, so is there anything you want to add on this?
Yeah, definitely. It was an awesome feedback, and we hope that it really helped all our listeners. It's just, doctors, it's just all the basis is the structure. If it's aligned, you are good with the station. See, what Dr. Aisha has mentioned, the things, those are the very peculiar and particular things related to psychiatry, and you can add on it to all depression stations. Generally. So, Dr. Aisha, what you need to know is whenever a patient comes with a complaint in a follow-up session, you would need to be asked that you asked it that how what made you come in the first place, what were your symptoms and things like that. But don't just assume. The question one question of yours felt a bit cramped, that you said, do you feel the same lack of energy the way you felt before? You didn't ask the patient, yeah? Don't make such mistakes. It will alarm, like I am the examiner and I am listening to you, that what the candidate is actually trying to say. So it alarmed me that the doctor has not asked the patient, and the doctor has assumed. So that may deduct a lot of marks, despite you were doing the station very accurately. Yeah. So
Okay.
don't assume things. So whenever the patient said, doctor, I feel depressed and I need depressants. So you would have said that, well, we can help you with that. You said it. So first and foremost thing you should have asked that, I can see you are upset and distressed. Can you just tell me how are you coping with all the situation? The psychosocial is the first thing you need to be asking a patient who looks to be or seems to be depressed on a follow-up session. Yeah. Right after asking the the basic questions of since when you are feeling and what made you come in the first place. Then the rest goes along, which Dr. Aisha explained very well, that then you have to ask the medical questions, the DESA and psychosocial questions are really important. The diet, exercise, smoking and alcohol, rest you did fine. And management, as usual, you need to follow the steps by first telling the patient what you can do, and then must tell the patient the do's and don'ts apart from the medications and the therapies you can provide. The do's and don'ts, NHS loves them. Do's and don'ts mean the lifestyle modifications which a patient can do. Yeah. Rest was good, and we really appreciate that you participated. Yeah, Dr. Aisha, over to you.
Okay, so Dr. Asha, do you have any questions?
Dr. Aisha, you were mentioning, do we start him like if he wanted, he was concerned about his sexual life? I know that the best one is reboxetine. Do we start him on both sertraline and reboxetine or only reboxetine?
No, 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 no. If he asks that if there is there any other medicine that is available that doesn't call this, then you can mention about the reboxetine. Otherwise, if he asks that, you will say yes, just like any other medical condition, any other medicine, it also has some side effects, like it can affect your sexual life. But if he asks after that, is there any other medicine that you can suggest me, you can give me? So then you can mention the name of the reboxetine. That is a medicine that doesn't cause. But if you're going to give the reboxetine, you are not going to give sertraline. You will give
Okay.
one medicine at a time.
Okay, thank you.
There is one, there is a group CBTs, and there are the individualized CBTs. In the individualized, there is a one-on-one session, and that is the more focused one. And in the group session, there are a lot of other people as well, and you take them. If the patient is presenting having a group therapy, and he is not feeling better, so we can refer them, or we can offer them one-to-one session as well. But if they don't want to go for that, then we can give them antidepressants and all these things. So you can just say if it is group session or was it 101.
All right. Okay. So it's just an additional question, which even if you don't ask about,
That's fine. Yeah, yeah,
yeah,
yeah. That's
it's
totally
totally
fine.
fine. Not going into the types of CBT. That's what we mean.
Okay, so there's a bit confusion about treating the depression. So I'm going to list as we have discussed this thing in our group as well. So there are only four conditions where you are going to refer a patient to the psychiatrist or to the hospital, you can say. If the patient is psychotic and if the patient is having suicidal thoughts, in these two cases, you definitely you're going to refer to the psychiatrist and to the hospital because they need to be admitted there. And the third one is the postnatal depression. Postnatal depression is to be treated and diagnosed by the psychiatrist. But what GP can do, GP can talk to the while the patient is waiting for the appointment, the GP can talk to the specialist on starting the antidepressants. So that is the thing that you can discuss with the patient that while you are waiting for your appointment, we can discuss with your specialist and we can start you on the antidepressants. So the fourth one is if there is a resistance to the treatment, the patient is not responding to the treatment, whether you have started on the sertraline and you have started on another antidepressants, and but still the patient is not having any improvement, then you can refer to the specialist. So only these are the four things or the four conditions where you are going to refer to the specialist. Other than that, any other depression you are going to treat by yourself and you are going to treat in the GP.